In November of 2018, I had an arthroscopy because my knee was impacted. It started to swell. I had a full-blown lupus flare to the joint. And so we tried conservatively to manage it, but literally what happened is it became bone on bone. And so when this knee became bone on bone, this knee could not compensate for this knee. So I ended up with both my knees bone on bone, no cartilage at all. I was walking with a cane, and then I got to the point that even walking with a cane was terrible. I thought to myself, do I do one or I do both? This one can't compensate for this one, so that's why I decided to do both, which I would encourage anybody to do. I went off, had my surgery, and woke up in recovery room, and I felt great. As soon as I got back to the orthopedic floor, within an hour I was up and walking. Dr. Edwards is a phenomenal surgeon. He has a great bedside manner. He explains what he's doing. I knew I was in good hands, and I got great care. The reason I like to bicycle is because my grandchildren bicycle, and it's time that we can spend together. When I was younger, we used to bicycle a lot, and when my knees got bad, there was no bicycling at all. So my big goal was to be able to bicycle on Mackinac Island, the 8.2 miles around the island. I met my goal on July 3rd. I actually bicycled Mackinac Island, all 8.2 miles. I have my tag to prove it here, with my daughter, my son, my husband, my 2 grandchildren, and my son-in-law. And I did it in under 2 hours. And the beauty of that was that I wasn't sore the next day at all. My advice to anybody who has to have their knees done is to do it sooner than later. You have a wonderful life back. Enjoy it.